Over the past 20 years, we've learned a lot in mainstream medicine about how important the ecosystem of the intestinal tract is. What do I mean by the ecosystem of the intestinal tract? The microflora, the bugs, the bacteria, viruses, fungi, all the kinds of microbes that live in the gut are in a very complex system. There are thousands of different species of microbes that live there, and they live in a complex ecosystem that needs to be maintained in balance between the host, the human body, and with the external world. And it provides a very powerful system that has a lot to do with how healthy we are. When we alter that system of what lives there and what the balance is, it changes to a large extent our health and our relationship with our external environment and our internal environment. You could really call the stool an organ system. And if you want to learn more about this, you can go to the website drsaputo.com and put in the search box that and dysbiosis, D-Y-S-B-I-O-S-I-S, or something about irritable bowel syndrome, and all this information will come up that talks about what the ecosystem of the gut is and how it functions. An interesting study was published in the International Journal of Obesity, a study of 10,000 children who were put on antibiotics as infants during the first 5 months of their life for some period. And to their surprise, when they looked at 38 months of age at these children, 22% of them were more overweight than the others that didn't have antibiotics. What's going on here? How would an antibiotic taken during the first 5 months of life affect what you weigh at 38 months of age? The answer is pretty straightforward. What changes the ecosystem of the gut, the balance of microbes there, more than an antibiotic? Something will kill microbes, and then specifically mostly the bacteria, and not affect much of the fungi or viruses there. You got it. An antibiotic would do all that. And so perhaps what's happening is that those microbes that we need to have in a balance, in a large amount, are the ones that are killed by the antibiotic, and then we wind up with changes that occur in the way we burn the food that we eat. We know that what we eat has a profound effect on what grows in the intestinal tract. And these studies have been around for 30, 40, 50 years. We know that if you eat a high-fat, low-fat diet, it tends to cause certain microbes that live off of high fat and low fiber to be able to overgrow. And if you don't provide enough fiber in the diet, those bacteria that normally are the friendly ones, the acidophilus, the bifidobacter, some forms of E. coli that we need to have, simply can't be fed because that's what they grow on. So that undigestible fiber that we can't use actually fertilizes the intestinal tract and allows these bacteria that we need to have grow there be fed and grow as they should. We know that if we eat a diet that's high in meat and is low in other things, that different kinds of bacteria again will grow. If we're lactose intolerant, meaning we can't digest the lactose that's in milk and we consume milk products, we're going to be putting a lot of lactose in the body that we can't digest, that now bacteria will digest, and again is going to change the microflora of the gut and change that relationship between the internal and external worlds that it reflects. So when we see these changes that are published in this journal, talking about antibiotics having a profound effect on weight gain, that's the tip of the iceberg. There are many, many other things that will be involved by this as well, because that system, that saprophytic relationship that we have, where we feed the microbes and the microbes do certain services for us, is a very important one. So keep in mind that we need to be eating foods that are healthy for us. We should be avoiding things that can change the microflora of the gut in a way that's negative. With the antibiotics and inflammation and some of the drugs that we're taking, it becomes a major factor. We don't know enough about diet and its relationship to the microflora of the gut. We need to study that more. And as we have better technologies that can analyze what kinds of microbes live there and what their balance is, we'll learn more about how to do that. So I think we're on the right track. And finally, medicine is getting to a place where it appreciates that what we eat, how we live our life, how much stress we have, how much sleep we have, all affect the microflora of the gut, and that affects our overall health in a major way.